Hi, my name is Carl Handwerk and I'm a Cedar Crest College nursing student. Today I'm going to be speaking to you about a critical appraisal I completed on an article titled Spirituality and Spiritual Caring, Perspectives and Practice in Palliative and Acute Care Environments. This research was done by Ronaldson, Hayes, Agar, Green, and Carey. Research problem. Although spirituality and spiritual caring play a vital role to holistic nursing care, this topic is oftentimes difficult for nurses to articulate. The researchers state this difficulty is due in part to the nebulous nature of spirituality and to a general lack of language to define spirituality in nursing and to describe spiritual caring. Purpose. The main purpose of the research was to compare palliative care and acute care RN spiritual perspectives and compare that to their spiritual caring practices. By comparing these RN spiritual perspectives with the impact on nursing, it may be possible to identify differences between these groups that can help to understand the practice and culture of spiritual nursing care. Research objectives and questions. The article touches upon 6 underpinnings of questions. The first one being, do perspectives of spirituality differ between palliative and acute care RNs? Do RNs practice spiritual caring in palliative and acute care environments? Does spiritual caring practice differ between these two groups of RNs? Do RNs' perspectives of spirituality influence their practice of spiritual caring? What barriers to spiritual caring are experienced by RNs in palliative acute care? And do RNs' spiritual perspectives and spiritual caring practice influence barriers to such caring? There has been an emphasis on clarity in practicing spiritual care within the nursing approach over the past decade. This clarity is important to the nursing field because spirituality takes on an important role in the holistic approach to nursing. If these barriers to spiritual care can be identified, more can be accomplished within nursing practice to educate and overcome these barriers. There was no theoretical framework described in this article. The research was based on a conceptual model. The conceptual information will be collected through nurses' experience and knowledge, which will add to the understanding of spirituality and spiritual caring in the nursing practice. Variables and interventions. Because there were no interventions in this study, there was no education. There technically are not any independent or dependent variables. However, there are several research variables. One of the variables is the acute care environments that were used to conduct the study. These include general surgery, orthopedic, medical, and coronary units. Another research variable in the study was the amount of spiritual caring and spiritual perspectives of nurses in the study. The sample for the study was composed of 92 RNs total. There were 42 palliative care RNs and there were 50 acute care RNs. All of these RNs were chosen from a total of 7 intermetropolitan health services in Sydney, Australia. The study took place over a 6-month time frame. The ethics approval was obtained from the Institutional Ethics Committee before the study began. New nurses chosen from these units were invited to participate. However, no one was specifically recruited for this study. As far as the data collection, there were 3 components to this. The first was a socio-demographic survey, and then there were 2 validated research tools that were used on spirituality and spiritual caring. The first one was the Spiritual Perspective Scale, which was the SPS by Reed 1987. It measures a person's view on the extent to which they consider that spirituality has an impact on their life. It includes engagement and interactions and activities that are spiritually related. The second validated tool was the Spiritual Care Practice Questionnaire, the SCQP, by Vance 2001. This measured the frequency of assessment and interventions related to spiritual practice and the barriers to providing spiritual care. Both of these use the Likert scale. The SPS was 1 to 6 and the SCQP was 1 to 5. There were several results from the research. Both groups of nurses rated insufficient time as the most common barrier. Uh, the researchers also noted that acute care nurses also rated patient privacy as an equally high barrier. Palliative RNs maintained higher mean scores on both the SPS and the SCPQ. There was a statistically significant correlation between palliative RN's SPQ scores with the SPS. Demographic variable of years of experience was found to be significant for palliative care RNs compared to acute care RNs, and palliative care environments were more conducive to including spirituality in their nursing care. There were some limitations to the study, the biggest one being that the researchers only included RNs from 4 acute care units, that being general surgery, orthopedic, medical, and coronary. By not including other types of units and making the sample larger, they weren't able to generalize the findings as well as they would have if they would have opened the study up to more units. Implications for nursing practice. The researchers state that there's a recommendation for an increase in RN's education and self-awareness concerning spirituality caring in the clinical setting. They also recommend that ongoing programs should be instituted because they'll reinforce spiritual growth and help spiritual self-awareness. They raise the profile. They raise spiritual profile will continue to motivate nursing professionals to look for ideas to break down these spiritual barriers. In conclusion, the researchers state that for future research, they need to look at barriers that may be preventing acute care RN's involvement in spiritual caring, and also they recommend that some of these studies be done in more high dependency units. This study was successful in accomplishing one of its major outcomes, which was to raise the profile of spiritual caring among nursing units. I want to thank you for giving me the time to listen to me, and if you have any questions or I look for any feedback, thank you very much.